but as leaders. But I asked for a few more minutes to go back to the history of the Philippine General Hospital because it's deep in military history. And it started as a crazy dream of a zoologist from Michigan named Dean Worcester, who was part of the Philippine Commission together with Howard Taft in 1901. So the war between the Spaniards and the Filipinos ended when the war between the Americans and the Spaniards started, and the war between the Americans and the Filipinos started thereafter. And in 1898, the Treaty of Paris was signed, and the war stopped, and the government of the United States sent a Philippine Commission to oversee the rebuilding of a war-torn, devastated country. And under McKinley, President McKinley, um, General Arthur MacArthur became the Governor General, wanted a military commission to rule over the Philippines, but a civilian Governor General for the Philippines took over in 1901 named Howard Taft, who happens to be the best friend of Dean Worcester, and who create the crazy dream of Dean Worcester to create a a 400-bed hospital in the middle of the wilderness in the Philippines. But that dream became a reality when the Philippine Commission in 1907 enacted a bill, a law creating the Philippine General Hospital with the sole purpose of serving the poor Filipinos. So after we lost to the Rough Riders, after we lost to the Rough Riders who are well equipped, the other part of it was rebuilding the country. And Dean Worcester, together with Dr. Freer and Dr. Burns, with the Bureau of Science and the Bureau of Health, put up the Philippine General Hospital, a 400-bed hospital, 300 for the poor Filipinos and 100-bed for the private patients, which mostly were Americans at that time. So you can imagine how advanced the hospital was. It was an electric ambulance, the first one, and it was touted to be the best hospital in Asia at that time. And they chose a very charismatic and highly dynamic doctor named Victor Heiser as the first director of the Philippine General Hospital in 1910. The task of building the hospital started with the planning of Manila, a master plan of Manila and the whole of the country during the early 1900s, given to Daniel Burnham, who designed the Magnificent Man in Chicago, and who in turn commissioned neoclassic architect William Parsons to build the hospital for us. So this is the his rendition of the PGH at that time. If you notice, in the early plans of Daniel Burnham, he already drew the Philippine General Hospital, and Parsons. And Parsons took over and designed the PGH hospital. To our astonishment, there is an armory in it when we were rebuilding it, and there were tunnels underneath that span between the university and the hospital, and I suspect to the U.S. Embassy, which is nearby, but never proven. So we opened the hospital on September 1, 1910, and it was passed on to Dr. William Musgrave, the directorship in 1914. But as things would unfold, there was a huge nurses' strike in 1916 with so many issues on hand, and it led to the changing of the director to the first Filipino director, an obstetric gynecologist from our rival university, University of Santo Tomas, Dr. Fernando Calderon. And he went on to Philippinize the hospital, and nurses also were led by Teresita Anastasio, all Filipino team now running it. And in 1917, the first chairman of the Department of Surgery, Filipino, was appointed, Dr. Potenciano Guazon, whose memorial Dr. Wharton was able to see in our hospital. So he's credited to have been trained in St. Louis and in Chicago, and was the first one to do a mastectomy in our country. So the hospital has evolved in so many forms, but from the basic neoclassic design of William Parsons, the looks have been preserved, but destroyed during World War II. So PGH became the only hospital operational during World War II, but had to close temporarily when almost all the wards, when the majority of the wards were destroyed by the bombing of Manila. So rebuilding was done, and through the years, this is where we are now. Again, continuing to rebuild it to its former glory, and me landing as its 21st director in January 1, 2016. The story of my being director is actually not in my plan, my life plan. It was 2009 when I had a, a German intern from Stuttgart who shadowed me for 2 months. And at the end of his rotation, I asked him what his impression was of the Philippine General Hospital. Maybe for the lack of words, he said, Dr. Legaspi, I think life is cheap. Life is cheap in PGH. And I asked him why, and he said, when the patient comes in and he had no money, he probably will die. The problem was, my problem was it was true in some way. So I went to the director's office to complain about this. And after 2 hours of arguing with him, I came out as the chairman of the Pay Hospital, assigned to earn more money and give back to the hospital and to the charity hospital. And after that, in 2016, so as you said, the rest is history. So I'm now in my 9th year as director of the biggest tertiary hospital in the country, and with only one thing in mind, that to think of something at the end of my tenure, just like Steve Colby said, that we begin with the end in mind. And I think the end in mind is to have a colorful history from then on for my beloved hospital, which we've done with superficially during Christmas with the slides. So another crazy dream also came out of PGH, that of Dr. David Wary. And this is a 1997 picture, actually, before the relationship between USUs and PGH is done. And by far, we have had 15 resident scientists having rotated during the early formative years. And I'm happy and proud to tell you that 10 of them stayed with us in different capacities. Called in order, from left to right: coordinator for training, the head of our breast clinic, the head of trauma, myself. Dr. Amcoy Lopez is now the robotic surgeon and colorectal surgeon, the head of the Pay Hospital, my previous job. Apples is now with our general surgery, head and neck and breast care clinic. Sheila is now the training officer of surgery, and Dr. Russell Kirol is my coordinator for equipment, handling, buying all those advanced equipment that we have, and he's a thoracic surgeon. And one of them became a nun. So we continue to talk about this relationship, and I was really happy to have hosted the team headed by Dr. Wharton to PGH in December during our annual convention, and I hope things roll in as we want them from here on. So that brings me to my topic of surgeons being a leader. And I think as surgeons, we are natural leaders because we are more goal output oriented than process oriented. And the proof of that is in Manila, 60% of those who head hospitals are surgeons. Even our Secretary of Health, Dr. Teodoro Herbosa, a trauma surgeon, is a trauma surgeon. You don't have to look far. I think in the military service, a lot of the positions are held by surgeons as well. So this has brought me to a question often asked by students or by civilians of myself, how it is to be a neurosurgeon or a surgeon. So I answer with the story of 3 doctors who died: a pediatrician, an internist, and a neurosurgeon. On their way to heaven, they had to stop by the gates of heaven because when it opened, God was there, sitting on his chair, with two empty seats beside him. And he asked the surgeon, and he asked the pediatrician, "You pediatrician, what do you believe in?" And he said, "God, I believe in the Holy Son. So you sit here on my lap. You internist, what do you believe in?" "God, I believe in the Holy Ghost." "Okay, sit here on my right." "How about you, surgeon, neurosurgeon? What do you believe in?" "God, I believe you're sitting on my chair." And this is that chair for our God of neurosurgery who first came back in 1951. And from that chair, my chair as a God, I transferred to this chair as director of the hospital. And it's been a different ride since then. For us surgeons, everything outside the operating room is trivial. Now, in the context of public health care, 80% of which comes from the uh, outside the hospital, I see myself as the one trivial. And I have to work to gain relevance to the healthcare that we have, problems with the healthcare. And that, as I said, brought me to my position with no degree in masters in or in hospital administration or business administration. There was no playbook, so I thought I just ran the hospital like I ran the operating room. So since there was no playbook, I had to learn a lot about this 117-year-old hospital in a 10-hectare property in Manila with 23 standalone buildings with almost 1,500 patients and seeing 700,000 patients a year. I supervise the various personalities of 4,600 employees and make sure that the trainees that come to us get what they have come for. Our history has brought us to the day that we became a COVID referral center in March 30, 2020, and things have not been the same since then. We've served almost 11,000 patients with COVID, spent a lot of our money, disrupted our training, but also in some way allowed us to test methods that made us get away with no mortality of our direct COVID healthcare workers, more than 2,000, 4,000 of them. We had record research and the government attention that we got brought us to a lot more resources in the future. So since there's no playbook, there's no forward planning. I don't believe in mission, vision, or strat plannings, but going back to what has happened in the last few years, I realized what Steve Jobs said years ago is that you can't connect the dots looking forward, you can only connect them looking backwards. And I'm just praying that what we have done in the past actually is going to be good for our future. So in the management of the hospital, again, looking backwards, I did not really plan anything on a theoretical basis. But I realized that what we've done as leaders in the hospital, surgeons, brought us to some lessons in management that a popular CEO in the Philippines realized when she ran the worst Boston Marathon in 2018. And the steps of management that she applied eventually to her business was to make your purpose clear, get the proper people to do the job with you, adjust quickly, make sure you're properly equipped, and focus to do outward to do better. Making your purpose clear is absolutely necessary because you have to articulate it clearly, and you have to make sure that people you work with are included in the plans, and they know about the plans, and they're well motivated. In my job as a medical director, I think the purpose is clear: health equity. Our country is a country of two nations, the haves and the have-nots. And I think our job as government physicians is to make sure that everyone gets the same treatment. Much like what FDR said when he said that the true test of the progress of a nation is not in adding to what those who have already, but in making sure that those who have less get more. I think that's the basic principle of health equity that we are talking about. And so I have no mission vision, I have no strat planning. I use taglines so that it will be easier to understand. So the concierge medicine that we want for our charity patients who have nothing is that we give them everything. That all they have to do is to lie down on the stretcher and to their beds until discharged. And we'd like to get out of the culture of mendicancy that a lot of government hospitals in our country are in. They make themselves look pitiful so that the senators and the congressman and in the public will give them more money. But I think that lessons the strive to be excellent, and we wanted to get out of that, and we wanted to spruce up the hospital because I told my people that yeah, you don't have to look poor to serve the poor, and I think that's what everyone's doing right now. So for COVID in particular, I had a problem with the um, massing up our troops because people refused to participate in PGH being a COVID referral center. There was no engineering available. We had very old wards, and but the job was given to us by the government, being the university hospital that we are. So in one late evening, I wrote a message to the people of PGH, not only students, not only the staff employees, but also alumni and other allies. And I called them the people giving hope, which is PGH, and told them that maybe we had to do it because it's the right thing to do. And after this letter, when the purpose was clear, everyone just chimed in. And the role now is make sure that your goals are communicated with them. And we had this daily information education committee churning out infographics that communicate the plans on a day-to-day basis. So as far as a team that you want to form, I think you want a star team, not a team of stars necessarily, because a team of stars, when they collide, that's going to be very painful. And we have to choose people who are not necessarily um, uh, the most sought after, but those that are committed to the principles and the plans that you have, those who adapt easily, and those who are willing to work with others. And I think in planning your manpower, especially during the time of COVID, I got hold of this scribbling we did on the board. This is the organizational chart of our COVID operations. Just a few people, and maybe they take their soldiers with them and march on to the war, COVID. So our COVID operations is basically all surgeons, but we all listen to the voice of science, which is the infection control head. And these doctors, these surgeons, came from various subspecialties. And because of their work in COVID, a lot of them now head the big hospitals in the Philippine General Hospital, including the biggest private hospital, headed by a neurologist. So during the time that we became a COVID referral hospital, I think being run by surgeons, it was easy to imagine the steps that we do as surgeons. We positioned our hospital as to take only COVID positive patients so that we get with severe or moderate or severe, so you don't get inundated by the mild or moderate ones, which were by the thousands. We prepped ourselves with the equipment. We protected ourselves with vaccination and with medicines. And of course, we opened on March 30, 2020. We had to adjust quickly, dissecting, exploring ways to do it. And thankfully, in the middle of 2022, we closed our centers as a COVID referral center. In the process, we found a lot of ways that we had to do and that we adjusted quickly. You had to be agile, but whether you have plans that are set, you have to be ready for disruptions. I remember I stopped issuing memos because I had to change them after 4 hours. So we just issued the infographics that were easier to change, and people really waited for those infographics every day. And conditions are rarely ever perfect. So we have to make ways that what we needed to do had to be done quickly and very painfully, and less painful for us as administrators, like this chaotic emergency room. There was a time that we had to CPR on patients on the floor. It was so full, there was no bed available. We were doing CPR on the floor. So we had to clear that up. We had to tell the Department of Health that we only will take in moderate to severe COVID, and they allowed us. So we emptied the ER and prepared it for the job that we had. We converted our wards, congested wards, into well-ventilated wards, getting the experts' help. These are private architects and engineers that gave us a unidirectional natural airflow system using exhaust fans and big ventilator fans that push the air towards the wards and sucked in air from the sides, the fresh side, and pushed it into our garden where no one stayed, no one dared to stay. So this allowed us a 6 to 8 cycle exchange per hour. And as I said, there was no death of our COVID workers, direct COVID workers in the 2.5 years that we were a COVID referral center. We also had the opportunity to digitalize. We were still paper based before COVID because the nurses and the other staff didn't want to touch the charts until after 3 days and after we provided treatment. One doctor who was an expert in computers created a digital an EMR for us. Was lost for 1 week. We didn't see him for 1 week, and we came back. He had a digital format for the 4 wards that we had, and eventually, after 3 years, it's now a hospital-wide EMR. So, of course, adjusting quickly will need you to be mobile and ready, and you have to be equipped for this. Not only with resources, but also with good plans that we have that will include the input of a lot of other people. And I guess this is the time where you should not scrimp on the plans that you have, more so on the actions that you need to do, so that you get the best of what you have to install for your patients. So I remember during the COVID times, no one had N95 masks, no one had PPEs. So I actually dealt with black market salesmen in the middle of the night to deliver $300,000 worth of PPEs, and maybe $100,000 worth of N95s. It had to be done, but you had to be equipped. We didn't want to open if we didn't have a whole 1.5 months supply of COVID. So whatever we do, I think it's inevitable that development follows money. So a government hospital like ours that got a lot of attraction because of COVID now has funding enough to make everything free for patients. And aside from that, we harness the private sector to donate to us, just like our alumni from the UPMASA have donated so much to improve the hospital. And we've learned how to also to do the joint ventures with private companies so that we build our buildings faster and with better designs. So because of that, we are now in the process of advancing technology in the Philippine General Hospital. From that time, and you will die if you didn't have money, now everything's given to patients, and we're able to give them much more than what we thought we could in the last 9 years. So robotic surgery is very frequent. We do intraoperative radiotherapy for early breast cancer now. We have a very unique service called the high frequency focus ultrasound for Parkinsonism, and all others that will require a university hospital to be in the forefront of not only medicine, but also in the service that it gives. So all of that is in the master plan, and I think the employing others to do it for us, we employed private architects and experts to do it for a government hospital, gave us another perspective of how to do things. And I think one of the things that we, as leaders, that we lead our people to is to focus outwards, even when it was getting bad. Because as realized by a lot of us during COVID, helping others actually helped us. It was a liberating experience to be able to help another hospital or another community, despite you being in a difficult situation. It was good for morale also of our people. And we helped set up COVID isolation centers around us, including those run by the military and the police. We sent nurses and PPEs to our small outposts in the universities and the communities. And we sent our technicians to train swabbers for COVID. And I think looking outward doesn't only mean in the immediate vicinity, but also now we are embarking on a global surgery program. We're sending our residents and our fellows to far off provinces to experience a primary care setting of the specialty that they're in. Of course, we are now in talks with Walter Reed for the resident exchange, and we have other PGH campuses, PGH hospitals that we're planning in the coming future. So we are expanding because the knowledge and the expertise that we have has to be shared, as I said, with others. And as leaders, I think, and as surgeons, we lead on a daily basis, like I said, but as we say, a daily firefighting business where we are in a crisis every day. And I think going back to what Bill George, the CEO of Medtronics, narrated in his book, Seven Lessons in Leading a Crisis, the first thing we need to do in leading a crisis like COVID is to face that the reality that there is a crisis. We have to identify it, and we have to start with ourselves believing that there is really a problem so that we can move faster. And as we move, let's not put everything on our shoulders. Let's get other people to help us, as we have done a lot of times, not only in admin positions, but of course in surgical situations where we are getting to a bad state. And we have to make sure that we find the root cause rather than apply superficial interventions, so that the interventions that we have go for a long haul. They are for a longer duration and more effective. Um, as leaders in a crisis, we're in the spotlight, and I think we have to be the true north of a crisis. So our values, our beliefs, how we were raised comes in, and we should never run astray from that. And I think that's one of the biggest temptations, in a difficult situation, being compromising our beliefs and our principles. But I think in a crisis situation, you really have to stick to what you think is right. And with that, you go on an offense and you focus on winning. And I put the never waste a good crisis last because that brought me back to the statement of Winston Churchill um, when he was organizing the League of Nations after the World War II, and he said that that's the good offshoot of the war. The crisis made them realize that they had to band together. And for us, the crisis meant more resources spent to us, and we were able to do more researches. We were record high researches during the crisis, maybe because our residents had more time and the consultants had more time to do research. From 8% publication rate to 81% publication rate during the crisis. So we were able to rebuild the hospital, and no one was there. So our old emergency room that looked like that, it's now looks like this, but still full, still 200% occupied. And we were able to restore some of the old buildings that were empty because of the crisis. So this is the old nurses' home where the conflict between the nurses, Filipino and American nurses, happened in 1916, with it being put up in 1911, because only the American nurses were allowed to live in the old nurses' home. And we rebuilt it to how the nurses saw it in 1911. We were able to also rebuild, in memory of the first Filipino chair of surgery, an operating theater that ran into disrepair, to now a converted, not to a theater, but to a special lecture room, which our friends from USU had that opportunity to visit last December. And the reason and the lesson also from COVID is that a hospital is a refuge during crisis times. And I think it is important that we provide our staff with an area to let steam off, or maybe just do some private moments. It helps a lot in the wellness of our staff. And they all asked for Starbucks in the hospital, so I had to give it to them. So because of that, in the middle of the crisis, For some reason, PGH was voted as one of the top companies in the country, the only hospital that made it in these 15 corporations. And lo and behold, our poorly ranked hospital had its biggest satisfaction, patient satisfaction during the time of the crisis. So with the crisis and all the things that have been happening with my 9 years director, I got out of that crisis with these four lessons that I brought with me. First is to fight the fear, and as well as help others fight theirs. To believe in good science, which we were, as an academic institution, we were fortunate to do very well. And we never let our guard down. Those masks had to stay longer in PGH than any other hospital in the country. And of course, the most important one, I think, is taking care of each other. And taking care of each other brought me to to the realization that people are our most valuable resources. They're not soldiers for us in the hospital, but actually partners in a cooperative effort to take care of patients. They are the greatest source of our pride and inspiration. And as Peter Drucker has said, there's no employee, only an enabler in the position that they're in. So I think one of the most important aspect that we do as a leader is to show up. You can't be a leader from behind your desk. Just like as surgeons, I think we're just like priests also. The surgery will not start without us in the operating room, and the mass will not start without the priest in the church. So we have to show up, and I think during the crisis, going into the wards and the PPE that you bought for the employees in the wards that you'd really signed for them and the patients added a little more um, um, connection to the employees and boosted their morale to fight. And you go with them not only in times of distress, but also in times of the good times. And I think one of the most significant things that happened for us was when I became officially the first Filipino who was vaccinated for COVID, which was Sinovac for us. So it was just like it's just another day in our lives as surgeons. But for the country, it was what kicked off the vaccination program, and what a few people allowed themselves to be vaccinated by Sinovac until Astra and Moderna and Pfizer came. So as we proceed to lead our people to transformational healthcare, I think we realize that transforming other people's lives also transformed us, myself in particular, from that neurosurgeon in God's chair to someone working in public health. And I think there are a lot of things that we need to do, but in the things that we plan for our hospital and our people, I think we dream of things bigger than us. We dream of things that are 3 generations behind us, that will take 3 generations to fulfill, so that the dreams are continued and made sure that people believe in them. And in the words of Theodore Roosevelt, when he spoke to the frontier soldiers in the 1800s, he told them to dare mighty things. This picture depicts the under part um, of the parachute that slowed down the descent of the rover, Perseverance rover, when it landed in Mars. And people realized there was a code in the pattern of colors. There's a binary code, and within hours, a father and son team decoded the message, and it said, the NASA people put it there. It said, they're mighty things. And they disprove everyone who told them that it cannot be done. So as we proceed on from here, I'd just like to say thank you again, and hopefully we are able to work together and follow this message from George Cantayana when he said, the difficult we do immediately, the impossible will take a little longer. Thank you very much, and mabuhay po kayo lahat.